First of all, is there a difference in the attitudes of the mothers and the fathers? Patty, there is in your case. I read about it in the paper. It must be true.
Well, I know my mom would like to get them herself. So,
she would?
Yeah. And my dad said if it makes me happy, then go
yeah,
for it.
Yeah, but wait a minute, though. It took a while for your dad to come around, though, didn't it? Or did you not keep it a secret from him?
I don't really have to keep it a secret.
When did he find out that you were going to have it?
Probably like a few days before.
Okay, and when did your mother know?
Probably a few days before.
Really?
Yeah.
And how did you break the news to him?
I just called him and told him I was getting an operation done.
And they just said, well, you know, whatever makes you happy?
I was like, why? And then I was like, well, it'll make me happy. And he's like, okay, well,
see, here's my suspicion. My suspicion is that most, if you have, for whatever reason, a bad nose, most parents would say, just like they would say, well, if I have the money and you've got bad teeth, I'll get you braces. If I have the money and you have a bad nose, I'll let you get a nose job. But my guess is that in most cases of parents, most mothers would probably say, well, if it makes you feel better about yourself. But most fathers would say, what? My little girl getting breast implants at 18? You got to be out of your mind. Now tell me if I'm right or wrong.
You could be right. However, I never see the fathers. I honestly have never seen a father who's come to
Doc,
my
there's
office.
a reason you don't see the fathers.
No, well, I don't know what it is.
He's sitting at home, he's angry. He's writing the check.
I can tell you the majority of the girls who come in to see me are with their mothers, and the mother keeps it a secret from the father.
Why?
I don't know. I think it's because it's a taboo area.
I think so.
No one will say anything. If a girl has big prominent ears at 15 or 16, no one will blink an eye if she has her ears pinned back. If she has a big hook on her nose, no one will say anything. But should she want to do her breast implants when she's flat-chested to feel better about herself, everybody says, oh, no, 17's too young. You know, the thing that bothers me about this whole thing about them being too young, how young is too young, is it looks at teenagers as like teens as a group, and it's not. Do you know that a lot of my patients who I've done have had a regular, normal-looking breast on one side and flat-chested on the other? Sometimes they have a lack of a muscle on one side.
Well, you brought some before and after pictures, and in some cases they're pretty dramatic. And again, we're showing you this to just give you an idea. Doctor, look over the monitor, see to the left. Yes. Obviously said this is before.
This is a 17-year-old girl who I did before and after, and this is she from the side.
Okay. Let's take a look at the next set.
And this is another girl who's 18 years old. These are implants which are under the muscle and look very natural.
Now, wait a minute. See, here's, okay, the one on the left doesn't look, and I'm no doctor, but I mean, the one on the left doesn't look terribly flat-chested. What's wrong with that?
Well, if she was 5'2" and she had those breasts, then I would say yes. But this girl's 5'7.5" or 5'8". So at that height, her breasts are quite small. That's about an A or very small B cup.
It looks like you really went to town, though, on the right-sided picture there, Doc.
Well,
I mean, how big will you go?
From the side.
Okay.
From the front, it's not so bad.
Okay, now on this one,
I try only to go up about one cup size. And,
okay.
Maybe 2 cup
and in
size at the most.
This particular case, again, not terrible on the left side. But, you know, what's the problem there?
Well, it's not my perception. It's what the girls come in. It's their perception of themselves. From the side, the breast always looks a little bit bigger, but she doesn't have much breast tissue there. She really doesn't.
Okay, now, first of all, to do it alone, a young lady has to be, what, 18?
Yes.
Okay, so she can sign for herself at the age of 18. Who do you kick out of your office? Who do you say, you don't belong here?
Well, I talk to them carefully. If there's a girl who comes in with, say, a full B cup or a C cup, I try to discourage them from doing implants at a young age.
Yeah, see, you know, over the years we've had these women who are adult entertainers, and they have these huge breasts, which are obviously huge saline implants. And see, I look at those women, and later on, of course, they have lower back problems and everything. And I'm not trying to make fun of them or anything, but I think the doctors who do that ought to lose their license.
I don't do any of those patients. I never have, and I never will. I don't have any of them in my office, and I think that you destroy their bodies, because a lot of these women want to look better and look natural and feel good about themselves, and they put in these huge implants only thinking that in the future you can take them out and there are no consequences.
But sometimes they're a joke, though. I mean, we have a couple of pictures.
Oh, yeah, they're terrible.
Give me your quick opinion. Okay.
All right.
Okay. Pamela Anderson. Little bit of overkill there, Doc?
Oh, first of all, overkill, and those implants were put on top of the muscle so that you can really see the whole implant. I put them under the muscle, which gives a much more natural appearance. That's why in a young girl they look better.
Demi Moore.
Yes, look at the same thing on top of the muscle with implants too large. They look very unnatural.
Okay.
The key today is to look as natural as possible.
No.
Yeah, here's another one, Tori Spelling. They tried to dissect too close to the center. These are all Hollywood girls.
I mean,
going too big.
I know. What's the problem there? I mean, Tori Spelling's got more money than God. I mean, if she can't get a good plastic surgeon, who can?
Well, that's the whole thing. That's an important point. Is that you have to go to someone with experience with breasts. I think that today there's so many people doing cosmetic surgery, you don't know whether you have a dermatologist or maybe you have a gynecologist. Perhaps they're good, but they don't have the experience that some of us have who've been well trained in breast surgery.
Okay, so Patty, you're a satisfied customer. No question about it. And Dad and Mom are okay with you. And I still think you saved $3,000 and you maxed out your credit cards and you'll be paying for a while. Thank you for being with us. Thank you for being so honest. And out MD, the body doc who practices in Ballackinwood, PA. I thank you, sir, for being with us.
Thank you for
Stay with
inviting
us as Philly After Midnight continues. Don't go away.